All right, let's talk about a huge question in the pharma world, one that a lot of people get wrong, and getting it wrong can have some pretty massive consequences. We're going to dig into the absolutely critical role that senior management has to play when it comes to quality. So let's get right into it.
So here it is, the big one. In the pharmaceutical industry, when it comes to quality, whose responsibility is it? I mean, really, who's on the hook at the end of the day? Now, if your mind immediately jumped to one specific department, well, you're not alone. But the real answer might not be what you think.
Yeah, the knee-jerk reaction for almost everyone is to point straight at the quality assurance department, right? The QA team. And look, don't get me wrong, they are absolutely essential. But thinking that quality is only their job, that it starts and ends at their door, that's a huge and honestly a pretty dangerous misconception. The responsibility goes way, way beyond that.
And let's be clear, this isn't just a matter of corporate philosophy or some nice-to-have idea. Nope. Regulatory authorities are crystal clear about this. The ultimate, final responsibility for the entire quality management system, the QMS, it rests squarely on the shoulders of senior management. The buck stops with them, period.
Okay, so if the big bosses are on the hook, where do they even begin? Well, it all starts with laying the groundwork. We're not talking about getting into the weeds of daily tasks here. This is about setting the entire strategic vision for quality across the whole company.
And that foundation really has two key parts. First, you've got to establish a really clear and powerful quality policy. Think of it like the company's constitution for quality. And then second, you have to define quality objectives that you can actually measure, turning that big picture policy into real actionable goals.
And here's the thing. A strong quality policy isn't just some generic feel-good statement you hang on the wall. No way. It has to be directly tied to three crucial pillars: patient safety, regulatory compliance, and the long-term sustainability of the business. You have to ask, does this protect our patients? Does this keep us compliant? And does this help our business survive and thrive? If your policy doesn't hit those three things, it's basically just words on paper. All right, so you've got your policy, you've got your objectives. Great. But a plan without resources is, well, it's just a wish. And that brings us to the next massive responsibility for senior management. You've got to provide the fuel for the engine. You need to give the system the resources it needs to actually work. Now, resources can sound a little vague, right? But regulators are super specific about what they mean. They're talking about having enough qualified people on staff. They mean providing adequate facilities and infrastructure. It means making sure all your equipment is validated and does what it's supposed to do. And it means having real, planned-out training systems in place. It's the whole shebang, not just one piece of it. And this is so, so important. You can't just say, oh, our budget was tight. When a regulator finds a quality failure, lack of resources is just not an acceptable excuse, ever. In their eyes, that's not a budget problem. That's a leadership problem. It's a fundamental failure of senior management's responsibility. Okay, foundation's in place, you've got the fuel. So what's next? Well, you need an engine to actually make the car go, right? Something that drives the whole system forward and makes sure it stays on the road. And in the world of QMS, that engine is the management review. Now, this is not just another meeting to fill up the calendar. A management review is a scheduled, formal, high-level meeting where the senior leaders, the real decision makers, sit down and take a hard look at how the entire quality system is performing. You can think of it as the mission control for the whole QMS. And we're not just talking about fluffy, high-level stuff here. They are diving deep into the real data. They're looking at trends and deviations. They're asking tough questions about whether the CAPAs, the corrective and preventative actions, are actually effective. They're going over audit findings, customer complaints, recalls, everything. This is where theory meets reality. And that's the whole point, isn't it? The goal here isn't just to have a nice chat. This isn't a book club. The goal is decisive action. It's about looking at the data and then making firm decisions, assigning resources, and driving real changes to make the system better. It's all about action, not just discussion. So when you put it all together, the foundation, the fuel, the engine, what do you get? And maybe the more important question is, what happens when one of those pieces is missing? Well, it all boils down to one thing. The outcome is the quality culture of your entire organization. And really, you can see two completely different paths a company can go down. With weak leadership, you get stuck in this vicious cycle of repeated deviations, kappas that don't actually fix anything, and eventually total system failures. But with strong leadership, you get a powerful quality culture, you get real accountability, and you get solid regulatory compliance. I mean, the contrast couldn't be more stark. And this is a really critical shift in mindset. You have to understand how a regulator sees this. When they see the same problems popping up over and over again, they don't see a bunch of individual mistakes. They see a broken system. And a broken system to them is a direct symptom of failed leadership and a lack of management commitment.
And this, right here, is probably the single biggest takeaway from all of this. A quality culture isn't created by a binder full of policies. It's not about what you write down, it's about what you do. It's forged by the day-to-day decisions, by what gets prioritized, and by the actions senior management takes. And just as importantly, the actions they don't take. That's what builds culture.
So I'll leave you with this question to think about for your own organization. When push comes to shove, when a tough decision has to be made about resources or priorities, what really drives that decision? Is it a genuine top-down commitment to quality, or is it something else? Because really, the answer to that question tells you everything you need to know.